Do physicians and other medical workers need to insert a swab through the nasal passage to the top of the throat of possible patients to test for COVID-19 or the novel coronavirus? Yes, that's true. A meme on social media illustrating the test is accurate, but also suggests that people not wanting to endure the pain of the procedure should stay home and wash your hands. A post published on Facebook on March 20, 2020, read, quote, "Exhibit A coronavirus swab. Yes, that is where the swab goes. So unless you'd like this done to you, stay home and wash your hands. Please." End quote. This is what users on social media saw. The point of the test is to grab secretions from behind the nose, at the top of the throat, for samples to be tested. The test is called a nasopharyngeal swab, or culture. According to NBC's Today Show on March 18, 2020, quote, "A healthcare worker will gently insert what looks like a long Q-tip as far as it'll go into a person's nose, twirl the swab to get a good sample, then remove it and place it in a vial, which is then sent to a lab for testing." One TikTok user who filmed herself getting the coronavirus test in a drive-through facility cringed, winced and coughed afterwards. "Felt like I was being stabbed in the brain," she wrote in the caption. "It's awful, I'm sorry," the healthcare worker is heard saying in the video. "I wish there was a better way to do it." End quote. Yale School of Public Health assistant professor Amy Bay explained who should be tested, and what is involved in the testing, in an article on the school's site. It was AQ and AMP, a found here. But here's a snippet that describes who should be tested, quote, "Testing is currently recommended for people who have symptoms, such as a fever greater than or equal to 100 degrees, cough, or difficulty breathing. If symptoms like these develop, call a doctor first and discuss with them the specific symptoms and also potential exposures, either with individuals known to be infected or if you live in a community where cases have been detected. Right now, testing is not recommended for individuals without symptoms. An order from a primary care physician is needed to be tested for COVID-19. The following is an advisory from Connecticut health officials. If you do not have a primary care provider, and you have the symptoms of COVID-19, please go to an urgent care center or to a federally qualified health center to get a doctor's order to be tested. Do not go to any medical facility unannounced for the safety of all patients and medical professionals. Drive-through testing sites are present on hospital grounds." End quote. As for what the intrusive test measures for, she said this, quote, "The CDC test is a nucleic acid-based test, which means that it is detecting the viral RNA in these samples. The test is not a rapid point-of-care test that can be performed quickly at home or at a doctor's office, thus it requires samples to be collected and shipped to labs with special equipment. The test uses a quantitative method of amplifying the viral nucleic acid in the sample to the point of being able to measure it. It usually takes about 24 hours from the time of sample collection to the final test result, but times can vary. The reason the test takes this long is that samples must be collected, stored at the right temperature, shipped to an appropriate authorized laboratory, the samples must be carefully treated, and run on a machine that can measure the amount of viral nucleic acid. Once the result is measured on the machine, the results can be communicated to the patient. A positive test means that there is virus in the respiratory tract of the person at the time of sampling. A negative test means that there is no virus in the person at the time of sampling, or that the amount of virus is too low to be amplified, which can occur if the sample is taken very early after the onset of infection, for example. End quote. Bay goes on to say that there are two types of tests, but the nasal swab is the only one so far approved for use. She explained, quote, "This may change as other tests are in development and are seeking approval from the FDA. The nucleic acid test is used to diagnose patients with active disease. There is also an antibody test under development that is used to measure exposure to the virus, current exposure or past exposure. This test is not meant to necessarily identify active cases, although there are ways of determining this from these tests, but it is mainly used by epidemiologists for surveillance purposes, to try to understand the extent of exposure in a population, whether or not the population know they are infected or feel sick.